So the aim for today is to look for innovation that will have real impact on suicide rates in the eastern region, with our ambition that we should bring them down to zero. We hope for positive discussions, that new partnerships will be forged today which accelerate those innovations and bring them to the people who need them. But this is also a chance to welcome the views and experiences and wisdom of people with lived experience.
How do you connect with these people who don't know that something is going on? That's a question, and I think it's something that you really have to think and mull over when you're talking about suicide prevention. This gathering here today is absolutely pivotal in furthering the issue of suicide prevention, because if we think about it, we're addressing an issue from our own lived experience when we come up for solutions. And something like suicide, when you're talking about the whole spectrum of mental health issues, there is no one-size-fits-all solution. So we need to make sure that we've collated as many different experiences as we possibly can so that we can come up with a number of different potential solutions.
Hi, my name is Richard Andrews. I'm the founder and CEO of Healios, and Healios provides a range of digital solutions within mental health and neurodevelopmental conditions across the UK. My biggest takeaway from today has just been connecting with just so many people who want to be part of this journey to change how we deal with people who are at risk of taking their lives.
So my name is Simon Glenister. I'm the founder and director of a social enterprise called Noise Solution. So the most interesting thing about this event so far is to actually see user experience being present at the table. People talk about it, but you rarely see it. So that's really exciting to hear and see, and also people's engagement and excitement with the idea of utilising digital technology.
My name's Emma Casimir, and I work with a charity called STEM4, and we've developed an app called Calm Harm. Wanted to come today to be able to tell as many people about Calm Harm as possible. We already have 800,000 downloads around the world, but actually we're looking for ways to fund further development, and the Suicide Prevention Innovation Day seemed like a perfect opportunity to meet the right people.
So my name's Kevin James. I'm here today as a lived experience consultant, so somebody who's spent the last 20 years using mental health and substance misuse services in the east of England. I'm also a member of the Citizens Senate, which is funded and supported by the Eastern Academic Health Science Network. What I like is the emphasis and the investment on early intervention, because there does need to be money invested in early intervention and youth services, and had there been that kind of investment and emphasis on youth services when I needed it in my early teens, then I don't think I probably would have ended up in using secondary mental health service users as an adult.
So an innovation exchange is a structured process that each of the 15 innovation agencies, the academic health science networks, are using to identify innovations, select the very best ones, and then support their adoption into the NHS. And that adoption is driven by needs.
I think the importance of this event was that we really wanted to get people talking. So having someone stood up in the front of the room is great, but it means that they don't get any feedback on what they're trying to do. And it means that people who are shy don't ask the questions that they want to ask.
I am incredibly hopeful about the future when it pertains to suicide figures and people who are I was going to say successful then at suicide. Isn't it awful, the words that we have to try and use in and around this issue, and it makes us uncomfortable about talking about it? Well, that's going to change. It changes with events like this today. It changes with normalising the conversation. And the more we talk about it, the more we get people being comfortable, saying, do you know what, I don't feel great today, and that's okay. The fewer people will get to that point where they want to take their own lives, and then we will be successful.